Hello, my name is Ashley, and today I will be discussing clickers in nurse education for our digital story presentation. I hope you enjoy. Just a brief introduction into the clicker system. A clicker is also called a classroom system or audience polling system. You may have seen something similar to this recently on Who Wants to Be a Millionaire, where they ask the audience a series of questions. It's similar to a remote control. It has letters and numbers used to answer questions, which are then transmitted into a computer or other device, and it calculates statistics in real time. Clickers have only been around for maybe about the past decade. Most lectures before then were pen and paper traditionally, and most tests were periodic and sporadic with the exception of the most dreaded pop quiz. Clickers have facilitated assessing the student at any point in time without collecting and grading papers. This presentation will review the students' perspectives related to clickers in the classroom. The first article that we will discuss is entitled The Impact of Clickers in Nurse Education, a review of the literature. This article is by Jenny C. DeGagny, and this article was found in Nurse Education Today. This is a literature review of 15 articles, and it refers to clickers as classroom response systems. It looks into classroom involvement in undergraduate nursing programs using clickers. It addresses three key characteristics of clickers in medical education, not just nursing, but also pharmacy, medicine, and paramedic educational studies. The three elements include interactivity and participation, satisfaction and learning outcomes, informative assessment and contentment teaching. Interactivity and participation. The article mentions that since the clickers are a deviation from the normal, it may engage students more. And it may also increase participation in that the student can contribute their answers without feeling singled out, embarrassed, or intimidated to answer in front of a large class. Satisfaction and learning outcomes. The article explains that satisfaction is imperative in good outcomes, and grades are better, and students tend to flourish when satisfaction is better. The cons noted in this article: some students do tend to dislike the clicker because they are expensive, and if the student and faculty are both unaware of how to use properly, it defeats its purpose. Formative assessment and contentment teaching. It is a great quick assessment tool. If you put a multiple question test on the overhead, you can instantly see how many students got it right. If most people get the answer wrong, then the teacher will know that there will be some additional teaching needed in order for the students to learn the material. Another important point in this article: clickers in medical fields may enhance learning, but in these fields, participation in an educational setting is often required. So it is a little bit difficult to gauge how clickers affect student participation in nursing fields because of the fact that most of the time participation is mandatory. The second article is entitled Use of Classroom Clickers to Promote Acquisition of Advanced Reasoning Skills. This article was written by Gregory A. Dubrow, and it was found in Nurse Education in Practice. This article does not emphasize just the satisfaction and assessment, but more about reasoning skills and critical thinking. The clicker response has to be in real time and usually within a matter of seconds, and feedback is given right then, which promotes critical thinking. It develops required reasoning skills by initiating active learning, garnering reciprocity by teacher and student. It gives prompt feedback, much like in nursing when decisions have to be made within seconds. It promotes participation and contact as well between the nurse and the student. This article reviewed a survey from students in a nursing class, and it was regarding their experience with clicker use. 75% were overall satisfied with the instructional and operational aspects of clicker usage. Some narrative responses in the survey were that using the clickers gave them real-time feedback of the correct teaching in the classroom. Also, it helped the students to see the quote-unquote big picture when learning a topic. About half said that they would prefer a class with clickers versus a traditional class. Similarly to the previous article, students did bring up the fact that the clickers were very expensive. They used a lot of battery life, and batteries were expensive as well. So this was a part of the dissatisfaction among some of the students regarding the clicker use. The third article is entitled Student Perception of Clicker Usage in Nurse Education. It is by Pamela Pfeiffer, and the reading was found in Teaching and Learning in Nursing. In this article, clickers are referred to as student response systems. They relate it to associate degree nursing programs. Some pros in this article included some similarly to the first and second article, and it promotes attentiveness, anonymity, participation, immediate feedback, and it also garners critical thinking in the fact that using the NCLEX questions as a part of the response system questions did help students with their critical thinking skills. Some of the cons was among the surveys found that students did not report that everyday use made them prepare for class. Only about 20% of students reported that the use of clickers helped them prepare better for class. Only about 45% of students in the survey stated that it helped them stay focused in class. Again, as with the first and second articles, cost was the main factor and the short use of battery life. In conclusion, clickers in the articles were proven effective because they garnered attentiveness from the student. It helped the student remain anonymous and avoid embarrassment for getting questions wrong. It helped with participation, and it also got immediate feedback for the answers. Some of the cons included mainly cost. The world of nurse education has changed from pen and paper to tablets and computers. Clickers have helped this transition from the old age to the new age.